Hello, everyone. Excuse me, hold on. Okay. Hello, this is Dr. Siddharth Damber. Welcome to our webinar today. Today we're talking about our peptide weight loss program. As I am talking, please go ahead and enter your questions, whether you are watching live on Zoom or whether you're live on one of our social sites as we're broadcasting. Go ahead and enter your questions, and after we're done today, you'll get a copy of today's webinar as well as if you have any questions, please email us, contact us on our social sites at any time, and we are here to help assist in any way. So today we are talking about, actually, I'm sorry, please hold on for 1 second. Okay, great. Sorry about that. Okay, so we are back online. So today we are talking about our peptide weight loss program. Specifically, we're talking about our signature weight loss program as well as some of the newer peptide options. So briefly, I think we all know that obesity has a really significant scope of problem in our not only country but our world currently, in terms of its effects on cardiovascular, metabolic, immunologic, overall well-being. In my clinic, we see so many people from a musculoskeletal standpoint that can benefit from weight loss as well. This is really an epidemic problem amongst adults, but it's also becoming a serious problem in so many of our children and adolescents as well. And so today we're talking about some solutions. So as I mentioned, the health effects of obesity, we know for lower extremity arthritis in the lower back, humongous problems, worse if because of obesity, cardiovascular problems, metabolic problems, higher rates of infection, higher rates of certain autoimmune conditions like psoriasis, and even certain cancers. So we need better solutions, in large part because of all the problems that are caused. In addition, the traditional methods of weight loss, in terms of diet and exercise, are absolutely essential, but they're not adequate for many people. And that's because you do have a lot of up and down in terms of that kind of yo-yo effect where there's some benefit and then you lose the benefit and it kind of goes back and forth. And we realize that weight loss and obesity is more than just, hey, you need to eat less. There's biologic issues, metabolic issues, psychological, environmental factors. And so what's nice about some of the newer peptide options is that they sort of address a lot of those things. And so our physician-assisted weight loss program, we are trying to comprehensively treat weight loss and obesity in a safe and healthy way. And our goals of treatment are certainly weight loss, but it's also, can we improve your muscle mass, your overall body composition? Can we improve your cardiovascular risk factors, your metabolic risk factors, improve your exercise capacity, improve your eating, improve your immune and gut health, and just overall improve your health, not just about weight loss. So when it comes to your nutrition and diet, there's 3 ways that nutrition can help with weight loss. First and most obvious one is you eat less total calories, you reduce your intake. If your output remains higher, you will lose weight. Number 2 is eat less of certain foods. The problem is that we're not exactly sure which foods. When you look at the general population, you see extremes of what people are doing from a dietary standpoint. Medically, what you see most medical societies recommend, they recommend more of a Mediterranean style diet. That's one that generally is focusing on lean meats, minimizing refined sugars, processed foods, and just generally a more balanced diet. That probably makes sense, but some people need assistance with that in terms of food choices. And then the last is eating during specific periods of time, intermittent fasting, where you're typically eating only certain blocks of time. In intermittent fasting, for example, it would be starting eating at 10, last meal at 6 p.m. Idea being that if you avoid some of that early morning or later evening kind of eating, that is likely helpful from a metabolic standpoint. What's interesting is that some of the newer peptides like the GLP-1 agonists work on all three of these. They can help you eat less, they can help you avoid the wrong foods, and they can even help you be a little bit more restrictive in terms of your times of eating as well. So peptides are naturally occurring molecules that signal other functions in your body. And what that really means is that they are proteins in your body that tell your cells what to do. So peptides can be utilized to emphasize pathways in your body that are helpful and to reduce pathways in your body that are problematic. This is certainly what is current in medicine and is the future of medicine as well. So the biggest one out there right now are the GLP-1 agonists. So glucagon, like peptide 1, it's naturally occurring hormone that comes from your gut. Regulates your appetite, your insulin secretion, and energy metabolism. The ones that are out there, semaglutide, tirzepatide, retatrutide. You've heard other names for these, including Ozempic, Zepbound, Mounjaro. These work on different targets, but the biggest one is GLP-1. And again, they have a key role in controlling your blood sugar, your insulin secretion. That's why it's originally approved for diabetes. Incidentally, they found during studies that diabetics could lose weight as well on these meds. And they then found that when you take a look at people who don't have diabetes, also helps with weight loss. So incredibly helpful from a metabolic health standpoint, helpful from a weight loss standpoint, and interestingly, may help with a lot of other things as well. But what we know is that this helps by improving your metabolic state. It helps your blood sugar move into the muscles faster. It helps by slowing down your body's processing of food so that you're not emptying out so fast. And it helps to reduce that kind of hunger chatter, that food chatter that we have, so that you're not as hungry all the time. So it works in different levels, and it works in significant part when it comes to weight loss through that brain-gut reaction. As I mentioned, slows down the processing of food through your system, reduces that food chatter or hunger sensations. You'll feel fuller sooner, reduces food cravings, food preferences as well, which is interesting. So you're eating the right things, not the wrong things, and just the preoccupation and thoughts about food. So semaglutide and tirzepatide are FDA approved for type 2 diabetes and chronic weight management in adults. What's interesting about the weight management criteria is that it's for folks who have a BMI greater than 30, makes sense. And while BMI is not a perfect measurement of weight, it's one that is utilized by so many different studies and is generally accurate. And for semaglutide and tirzepatide, also approved for weight loss in folks who have a BMI over 27, who also have at least one weight-related comorbid condition. That can include things like high blood pressure, diabetes, cholesterol, arthritis, fatty liver, pre-diabetes, heartburn, PCOS, hypogonadism. So other future potential preventive indications may be in folks who are at higher risk for cardiovascular disease, folks who are at risk for prediabetes. There's even some thoughts that this can be helpful from a neurodegenerative disease standpoint. Things like Alzheimer's. They've actually looked at what is the progression of Alzheimer's, and semaglutide seems to help in that regard, probably something on the metabolic level. As an anti-aging option, very interesting. And of course, metabolic syndrome. Metabolic syndrome is where you have obesity, fatty liver, diabetes, which can then make you more prone to heart disease. So typical peptide protocol, at least when it comes to the GLP-1 agonists, is as follows. This is a subcutaneous injection. That means you're injecting yourself once per week. And you can inject that into the thigh, the stomach. The key is that you start on a low dose and then you escalate it as needed and as tolerated over the next few months. The other key is that your physician should be monitoring your weight, your appetite, and observing for any side effects. Concern that I have is that there's a lot of folks who are doing this on their own with very limited medical management, and that can work in some people, but the challenge is that what makes medical treatments, when you can do them safely, is if you are on the medical side, on the physician side, if you are obsessively monitoring people and making sure things do not get out of hand. The other key is checking your metabolic health labs every 6 months, at baseline and every 6 months after that. So the data out there for these treatments is really quite good. For semaglutide, the average weight loss at the 1+ year mark is about 15%. For tirzepatide, it's about 20%. And as long as you stay on treatment, the evidence is that you can maintain that weight loss long-term. If you combine this with good nutrition and regular exercise, that's how you maximize your results and stay healthy long-term. So when you look at the side effects, in general, semaglutide and tirzepatide, the safety profile is very, very positive. There's no such thing as no side effects. But when you look at the side effects that are most common in the GLP-1 agonists, is generally GI intolerance, meaning some nausea, some constipation issues. In most people, it's tolerable, or in most people, it will pass over time, meaning your body gets used to it after a few weeks. The keys to manage this safely in folks: start low, start slow, and as tolerated, you keep on going up on it if you're not reaching your weight loss goals. So as an example, let's say you start treatment and you've had some mild weight loss after the first month and you're tolerating it, we'll go up on the dosage. Let's say after a couple of months of slowly going up on the dose, you are noticing some more GI intolerance. Well, we'd probably pause on going up. We may go down, or we may give you something like a Zofran to help reduce some of that GI intolerance. Or let's say we're going up on the dose and now you're kind of losing 5-6 pounds per month. That's pretty good, right? There's no need to kind of go more aggressively than that, or 10 pounds per month. We want to be relatively conservative in that regard. We probably wouldn't immediately escalate treatment if you're losing weight appropriately. But the key is to do this slowly, safely, and appropriately. Now, the reality is with any medical treatment, there's potential for allergic reactions, there's potential for atypical side effects that can happen. Rare, but as long as your physician is closely watching you and following, you'll be okay. All right, and that's the same thing here as well. Lipotropics, that's another weight loss option that we're utilizing. This is different. It's not a peptide, but it's basically a collection of various supplements and amino acids and vitamins that helps with the overall metabolism of fat in the body. Improves your overall energy level, liver detoxification, helps in weight loss. It's not as strong as a GLP-1 agonist, but it's a milder version that can still be used. Overall healthy option, helps with overall hormone balance, boosting immunity, and possibly even joint health as well. It's an intramuscular injection. You inject yourself once per week. In my experience, if you combine this with peptides, you can get an even better weight loss effect. Health coaching, that's another key part of this. Started to work with Revolution Health. I've got Flare Health listed here, but we're now working more with Revolution Health, helping with nutritional and health coaching. This is key. And the reason why is that when you're making changes, education is key to understand what's right and wrong. Accountability to keep you on track is very key. The thought is that to create new health habits, it takes 60 to 90 days. And I think health coaching is very helpful in that regard. In my experience, that makes a big difference. Keys to optimized treatment: peptides are key here. Lipotropics as an add-on if needed. Exercise, nutrition, and some coaching as well. You combine all this together, this gives you the best chance for weight loss. From a nutrition standpoint, very key, eat a nutrient-dense diet, avoid overeating. My experience, as you're making changes to diet, it is helpful to work with a nutritionist. And again, Revolution Health helps us out with that. From an exercise standpoint, key to do cardiovascular exercise to assist with your weight loss and metabolic health. But strength training is also very key here. Otherwise, you'll lose muscle mass. Your body does not know whether to take out from muscle or fat when it comes to energy expenditure. So you have to do the right kind of strength training as well. Again, Revolution Health is very helpful for us in that regard as well. Some of the other peptides you may hear about are as follows. There's the GHRPs, GHRHs, gonadotropin releasing peptide and gonadotropin hormone releasing hormone. These are peptides that increase your natural production of growth hormone. There are a few different ones out there, boosting metabolism, increasing fat burning, and helping the body build lean muscle. AOD 9604 is another version, but it's a modified fragment of human growth hormone. It stimulates fat breakdown and inhibits fat storage, helpful for adipose or fat tissue around the gut in particular. Tesamorelin is another one that also stimulates the pituitary gland to release more growth hormone. Again, targeting fat loss along the abdomen and visceral organs is very helpful here. With all these peptides, safety first. Understand that most of these peptides are generally safe when used under medical supervision. Some potential common reactions would be injection site reactions, blood sugar alteration if you're not eating healthy and watching things carefully. Nausea can always occasionally happen. With the growth hormone peptides, there's fluid retention and sometimes headaches as well. Key with all these is start low and slowly escalate. Don't go too aggressively. Other thing is the GLP-1 agonists have very good data and published data. For the growth hormone peptides, not as much. Some of these treatments have limited published evidence, but they do have positive physician experience. I'd always say be cautious if you have other medical issues. Make sure your physician is aware of what else is going on with you. Some of these treatments, you need to be more cautious when you have other medical issues. Always follow with an experienced and knowledgeable MD, someone you trust. It's always a challenge when you're doing this with a service that does not offer a lot of medical guidance. Also be aware that their dosing cycles with some of the growth hormone peptides, intermittent breaks from treatment are important. Combining peptides is an interesting idea. Again, not a lot of data on this, but it's an interesting concept. Something for the future, possibly. For best results, combining peptides can be considered, but make sure you're doing it under the safe medical guidance and doing it with healthy nutrition and regular exercise. Keep in mind, this is not a quick fix. Slow and steady wins a race. And again, I keep on saying it, but work with a physician that knows what they're doing. There are certain things you should be aware of, but 100% your physician needs to be aware of. And to begin with, they need to be aware of the FDA rules and regulations. They need to be aware of how that affects compounding pharmacies as well. Your physician needs to be an expert at this. And they need to understand that regulation is a dynamic process, and they need to be able to guide you through this safely. You may lose access to some of your peptides if you're getting them through compounding pharmacies. Your options are you can get some of the brand name versions nowadays. Some of them are at a lower cost, some of them are not. You may change to another peptide or peptide combination, or you may just stay patient, and sometimes your peptide may come back online because regulation has changed as well. That has happened. Some frequently asked questions that I see. How long before I see weight loss? I'm sorry, hang on one second. Someone sent a really great question on one of our social sites. Yes, we can help you out with that, but different topic. So normally when it comes to weight loss, you should be noticing some early benefits in the first month, but there's an initial phase for like 3 months. Realistically, you should be on this for 3 to 6 months to really get a sense for how well it's working, because you start on a low dose and you slowly escalate. How much weight can you expect to lose? When you look at the studies for the GLP-1 agonists, it is 15 to 20% on average. That is a realistic number and an accurate number as well. And how long do you have to continue treatment? I always would say start with at least 6 months to see how well it's working. When you look at the data for the GLP-1 agonists, it's really a chronic weight management treatment, meaning you'll be on this long term. That could be years. That's where the data is. Lower maintenance dosing is possible. And also be aware that some peptides, not the GLP-1 agonists, but some that need to be cycled, and you may be off it for a period of time. Some other questions I've heard people ask: do you need to eat healthy and exercise when using these medications? To begin with, yes, it'll give you a more optimal result. You can still lose weight without doing any of those things. But the treatments will help you establish better eating habits, and they'll give you a better long-term result if you're eating and exercising appropriately. So can semaglutide and tirzepatide, the GLP-1 agonists, can they make your muscles and bones weaker? The thing is that as you lose weight, you will lose some muscle mass, not just fat. So the focus is improving your body composition. You have to do resistance exercises. That's how you maintain muscle mass. And you need to do the right nutrition to help maintain your muscle and bone health as well. Another question someone has asked me: they already don't eat much. Will treatment still help? Yes, some peptides can still assist with your metabolic health. Again, lipotropics, they work in their own way without actually affecting your how much you eat as well. So it can still be helpful. Another question: if you stop treatment, will you regain weight? Studies show that if you totally stop semaglutide and you don't do anything else to maintain your weight in terms of nutrition and exercise, then you will regain 2/3 of your weight. Key is maintain good nutrition and exercise habits long term. That's key. And then consider also being on these peptides longer term. Reason why is that the safety data goes out multiple years now, and maintenance use, you may be on a lower dosage, lower frequency than when you're in sort of the active weight loss period. Then how do peptides compare to other prior weight loss meds? Look, the peptides, they work better and they're safer. And so they are an exciting newish option for our patients because of how well they work. So a little bit more about our comprehensive physician-assisted weight loss program, focused on doing this in a thorough and safe way for you. Thorough evaluation, comprehensive evaluation to make sure it's safe to even do this and that you're an appropriate candidate. Working with my team, physician-managed team, where we are following and doing this appropriately in your case, very closely. Continuous monitoring and adjusting your treatment as needed, and regular lab monitoring as well to make sure that you are being treated safely. To learn more about our program, you can click on the QR code there. There's kind of what our starting pricing is as well. And that QR code will take you to our webpage as well as the peptide weight loss program information. Okay, great. Let me just catch up on some more questions here. Again, if there's any questions, please shoot them into the chat section. Okay, interesting question. Somebody asking on YouTube, asking about, they've started taking Wegovy, which is a type of GLP-1 agonist. They've got psoriatic arthritis, ankylosing spondylitis, and Hashimoto's. And they want to know about decreasing inflammation. I agree, it's an exciting idea. You know, for conditions like psoriasis and psoriatic arthritis, we know that weight loss directly helps out those conditions and reduces inflammation. So I would expect that in your case as well. In terms of how quickly, you know, with all these treatments, I think you have to give it a couple months. I would think within the first month, you would notice some changes. It's different if you're taking something for weight loss where you probably need to be on a little bit higher dosage versus inflammation. And I think as you improve, the way that these treatments work from a metabolic health standpoint is that they basically push your blood glucose into your muscles faster. And by improving your overall metabolic health, that's what helps improve your inflammation as well. So I would expect you to notice some early benefit early on and then progressively getting better. But happy to hear that you're utilizing it and that you know, you're excited for its effect on inflammation as well. I agree. That's a good question. Okay, great. Well, listen, if there's no more questions, I'm going to start to wrap it up. To learn more about our physician-assisted weight loss program, go to chicagoarthritis.com, click on the QR code that you see up there as well. Again, you'll receive a copy of the replay of this webinar. You can watch that. You can share it with friends or family who you think would benefit. And if you have any other questions afterwards, contact us either on the website or on any of our social channels. And if you'd like to be evaluated, please check us out at chicagoarthritis.com. Thank you, everyone, for your time. Appreciate you attending today. And until we connect again, have a good day and live well.